Yes, sir. Yes, sir. Double no. So when you people will start studying abdomen?
Sir, 1 month before the exam.
1 month before the exam. When is the exam?
29th.
28.
Pakka 29th.
28.
Sir,
28.
anatomy department only told, sir.
Should be ma'am. So 1 month before 29th.
This 29th.
Earth month must be rotated.
No, sir, this 29th.
This 29th. That's what I meant.
Next 29 is the exam.
Next 29th.
So this 29 will start.
अच्छा.
ये बाबा तो आला था
एक क्वेश्चन
Okay, shall we start?
Yes, sir.
Okay. So today our topic of discussion is prostate. Okay. So what is the use of prostate in case of males? Contributes to semen. Okay. So the prostate gland adds up the seminal fluid. Getting it all right? So which is a little bit acidic. So there are few other glands in the urethra which secretes mucus. So why there must be glands within the urethra, either in male or female? Why there must be glands in the urethra?
For easy passage of the circulation.
It's okay, whatever.
Communication.
Exactly, this is acidic. The secretions of the prostate are acidic.
Alkaline secretions.
What?
For alkaline secretions.
Absolutely. The acidity will be neutralized over here because it is very much smoother mucous membrane over here. So just like the gastric acidity, there must be acidic nature in the prostatic secretions which should not hurt the mucous membrane within the urethra over here. So there are mucous glands within the urethra, either in the male, of course. Of course, there is no prostate in the females, but still there are mucous glands in case of female urethra. Okay, we'll discuss that later. First of all, about the prostate. Prostate is a conical fibromusculoglandular structure. What is it? Fibromusculoglandular structure means what? It has white fibers, smooth muscles, and glands will be there. Okay. So what are the glands? What type of glands are present in the prostate? Already would have done the histology. What type of glands? Tubular or acinar or tubulo-acinar or what? Tubulo-acinar. Okay. These things are important for histology. Okay. So prostate is a conical fibromusculoglandular structure. So the glands will be secreting the secretions, and fibromuscular part will be, what will happen? Obviously, the muscle fibers will be squeezing the prostate so that the glandular secretions will be secreted into the urethra over here, prostatic part of the urethra over here. Okay. So the prostate gland contains anatomical and surgical. These lobes are important. Two sorts of lobes. One is anatomical and one is surgical. Anatomically there are how many lobes? 5 lobes. 3 lobes. Anatomically there are 3 lobes. How they are oriented over here? One is the median lobe and the others are lateral lobes. Okay. So if you see over here, 3 lobes. Okay. This is the anterior aspect of the prostate. If you are taking a cross section of the prostate, for example, if you are taking a cross section over here. Okay. So this is the anterior aspect and this is the posterior aspect, right side and left side over here. Okay. So these two are the lateral lobes on either sides over here. And these two lateral lobes will be connected by means of an isthmus over here in front, that means towards the anterior aspect. With respect to which structure? With respect to the urethra over here. Urethra will be passing in the middle of the prostate over here. So in front of the urethra, prostatic part of the urethra, the 2 lateral lobes which are enveloping the urethra will be joined by means of a fibromuscular isthmus over here. Okay, what is it? Fibromuscular isthmus. Okay. Behind these two are united by means of a posteromedian sulcus. Sulcus means a sort of depression over here. Okay, so this must be in this manner. Sulcus must be in this manner. Okay, but these are joined together by means of this sulcus over here, that is nothing but the posteromedian sulcus. Okay, so little above the, so for example, if the lateral lobes are situated over here, okay, and median lobe will be situated over here. Just above the lateral lobes is the median lobe, that too on the posterior aspect over here. If you take this part over here, this part is the median lobe. Rest of the areas is occupied by the lateral lobes anatomically. So how you can identify? These are the ejaculatory ducts over here. Where are the ducts of the seminal vesicle join with the vas deferens over here? Is it not vas deferens? That will form the ejaculatory duct over here. Those ducts will be opening into the prostatic part of the urethra in an area called Colliculus seminalis. We will be discussing that later. Why I am asking? Because histology is already over. Okay, so this part is the median lobe over here, and the rest of the areas are occupied by the lateral lobes, according to anatomically. But surgically how these are oriented over here? Whenever these are united over here, surgically there are 5 lobes totally. 2 lateral lobes already over, and the same median lobe over here, so totally 3 lobes got over. Okay. But whenever these two are united in front, this individual isthmus is considered as anterior lobe over here. Getting it or not? So this individual isthmus is termed as the anterior lobe. But whenever these two are uniting on the posterior aspect, this unity over here is termed as the posterior lobe. Nothing but whenever the two lateral lobes are uniting anterior and posteriorly, this part, this union by means of this isthmus is termed as the anterior lobe, and on the posterior aspect, both lateral lobes are united without any this isthmus part. Directly they will unite with each other. Okay, but with a sulcus in between them. So this part is termed as the posterior lobe. Wherever they are uniting, it is termed as the anterior lobe. Wherever they are uniting, it is termed as posterior lobe. Did you understand? Right? And the medial lobe will be situated a little bit above the lateral lobes over here. For example, the lateral lobes are there over here. Above the lateral lobes and towards the close to the urethra is the median lobe over here. So totally 5 lobes surgically. Getting it on? So there are zones within the prostate which will be asked as short lobes. Okay, there are totally 3 zones. Peripheral. Why these zones are needed? Glandular secretions and any other clinically?
For carcinoma and
Exactly.
hyperplasia. Hyperplasia.
Exactly. Okay. Peripheral, central, and transitional zones within the prostate. What are the 3 zones over here? Peripheral, central, and transition zones. How we can divide? How we can divide it?
One around the urethra
Okay.
and the medial zones and one around the 2 urethra sections.
Around the 2 ureters.
Urethra.
Okay, let us see the prostate with the zones from the sagittal section. Okay. Sagittal section, right? So, this is the urethra which is passing through the prostate over here. The urethra around the prostate is divided into pre-prostatic part and prostatic part, and then followed by the membranous part of the urethra. Okay. Pre-prostatic within the prostate and then followed by membranous part of the urethra over here. Okay. We'll discuss that later. So how the zones are divided over here. First of all, there is a peripheral zone which is in the form of U-shaped over here. Whatever you are seeing the violet colored structure over here. This is a U shape. If you take the prostate as a cup, so that forms the peripheral zone. Within that cup, there are two more zones over here. Okay. So whatever you are seeing over here, the yellow colored marked structure over here is the central zone which are surrounding the ejaculatory ducts over here. Getting it? So this entire part is occupied by this central zone over here. Central zone means it will be around the ejaculatory ducts over here. It will be in the conical form over here. Getting it or right? So peripheral zone we have formed towards the posterior aspect because ejaculatory ducts are present on the posterior aspects. So around the ejaculatory ducts there is a zone called central zone over here. And then further behind will be the ejaculatory ducts, in front will be the prostatic part of the urethra over here. But here there is a urethra called the pre-prostatic urethra. Pre-prostatic urethra is not by means of before the prostate over here, but till the end of what is it? But till the end of what is it? Okay, fine. So see that. There is a swelling within the posterior aspect of the urethra which is passing through the prostate over here. That is called the colliculus seminalis. Just now I have told you. Okay. So till this part, the urethra before the prostate, and after entering into the prostate, till this part. That means till this part is the pre-prostatic part of the urethra. Getting it or not? So for example, there is a swelling over here within the prostatic part of the urethra over here. So before this colliculus seminalis, this entirely is termed as the pre-prostatic part of the urethra. Getting it or not? Not because it is outside the prostate gland, but even though it will be reaching till the colliculus seminalis. Okay, so till the colliculus seminalis, even though it is within the prostate, it is termed as the pre-prostatic part of the urethra. Getting it or not? Right? So till this part is the pre-prostatic part of the urethra. This pre-prostatic part is surrounded by means of a zone called the transitional zone. Here the transition of pre-prostatic turns into prostatic occurs over here. Transitional zone. Transition means from the esophageal part will be turning into the stomach part of the epithelium. Stratford Scribus non-characterized epithelium transition into columnar epithelium. In the same manner, the pre-prostatic part of the urethra turns into prostatic part of the urethra at this level. Okay. So this zone which is encircling the pre-prostatic part of the urethra is termed as the which zone? Transition zone. So if you take a cup in this manner, so this is the peripheral zone over here. Within that, behind will be the central zone which is enveloping the ejaculatory ducts because ejaculatory ducts are present on the posterior aspect. In front will be a circular zone that is nothing but the transition zone enveloping that means encircling the entire pre-prostatic part of the urethra. So totally 3 zones. This is entirely enveloping everything, but transition will be enveloping the pre-prostatic and central will be enveloping the ejaculatory ducts over here. These zones are important. Okay. Among them, if you see properly, this part will make the median lobe. What is that? Median lobe of the prostate will be in between the urethra over here, pre-prostatic part of the urethra and the ejaculatory ducts. In between these two is the median lobe, anatomically or surgically. Getting it or not? So this part over here will be giving rise to carcinoma. Among the carcinoma, benign prostatic hypertrophy, this part, peripheral zone, will be giving rise to carcinoma. Malignant form of prostate will be given by means of the peripheral zone, and this zone contains the median lobe, so obviously it is benign prostatic hypertrophy. Benign prostatic hypertrophy will be occurring from transition zone over central zone over here, but from the peripheral zone there will be malignant prostatic hypertrophy occurs over here. Getting it or not? Benign because it occurs because of the hormonal imbalance. In case of elderly individuals, there will be hormonal imbalance because of the action of the testosterone over this gland. This will grow. Getting it or not? So because of the hormonal imbalance, it is benign prostatic hypertrophy. Hypertrophy means the size of the gland will increase over here. Okay, size of the cells will be increased over here. So this is the benign portion and this is the malignant portion over here. This will be asked in the examination. Okay, the peripheral zone, malignant. It will spread to other areas. How it can spread? Yeah, exactly. So the prostate is surrounded by, that is, the prostate is surrounded by prostatic venous plexus over here. That means the veins which are draining the prostate will be around the prostate except the posterior part. Okay. On the lateral aspect, on the anterior aspect, there will be prostatic venous plexus which are present in between two capsules of the prostate over here. What are the two capsules? Exactly. So true capsule, among these two capsules encircling the prostate, which one is true and which one is false? Always inner one will be the true capsule and the outer one will be the false capsule. Why? Because the true capsule will be secreted by the stroma or substance of the prostate or any other gland if you take. Thyroid or parotid or whatever it might be. The true capsule will be lying on the inner aspect secreted by the stroma, but the outer aspect will be formed by either deep fascia or any other fascia. Getting it out? So, this outer false capsule would have formed from which fascia over here? Pelvic fascia, obviously. We have already seen in the last class. The pelvic fascia will be encircling the urinary bladder above and prostate below, right? So from the pelvic fascia, this prostate fascia, nothing but the false capsule will be formed over here, encircling the prostate. So in between the true capsule and the false capsule, there will be prostatic venous plexus. These venous plexus will be going backwards over here and will be draining into venous plexus which are situated in the vertebral column over here. Get it or not? So if there is any malignancy occurring over here, the malignancy, for example, this is occurring in the peripheral zone over here. That peripheral zone is very much close to these veins over here, and the malignant cells will be traveling through these veins, and that will be draining into the paravertebral veins over here. So paravertebral veins, if they are involved over here, the vertebra will be getting the metastasis over here, and further it will be reaching up to skull, and of course the brain also. Get it or not? So the carcinoma over here will be spreading towards the brain through these venous plexus over here. This will be asked in the viva over here. Get it or not? How the prostatic carcinoma spreads to the skull or the brain over here. So what is the root? Prostatic venous plexus, and there will be a vein communicating with the paravertebral veins over here, and that will be reaching up to the brain or skull over here. So this course will be asked in the examination. Always in examination, how the infection spreads from one area to other area will be asked, and how the carcinoma spreads from one area to the other area, through which route. Getting it or not? So generally, the malignant cells will be passing through the veins. Why through the veins? Why not through the arteries? Yeah, veins wider lumen. Any other? No valves. It's okay. Simple logic, right? Exactly. That is the reason. The veins will be draining the blood all the way from the particular organ into other areas. Is it alright? Right? So through the veins only, the malignant cells will pass. Okay. So these are the coverings of the prostate over here. Okay. And one more thing, the deep dorsal vein of the penis. What is the deep dorsal vein of the penis will be also be draining into prostatic venous plexus. Getting it or not? So the deep dorsal vein of penis, could you able to remember from the last class? Right? Superficial deep dorsal vein of the penis and deep dorsal vein of the penis. So the deep dorsal vein of the penis which drains, simple. Deep dorsal vein of the penis will be close to. Deep dorsal vein of the penis will be close to. Deep dorsal vein of penis is situated over. Forgot, huh? What right? What? I'm not getting you. What is it? It's okay. What I'm asking, where it is situated? Within the penis cross section, where it is situated? Exactly. Superficial dorsal vein of the penis will be situated within the areolar, loose areolar tissue of the superficial fascia, and the deep dorsal vein of the penis will be situated beneath the fascia of the penis over here. So it is very much close to corpora cavernosa and corpus spongiosum. So the veins, the arteries which are giving the blood to the corpora cavernosa and the corpus spongiosum will be drained back all the way from deep dorsal vein of the penis. Getting it on it? This deep dorsal vein of the penis will be draining into the prostatic venous plexus, and from prostatic venous plexus it might drain into, small guess, what? Vertebral veins, it's is okay. It's a different thing. Generally drains into. No, that is a different thing. What I'm asking is prostatic venous plexus. Into what veins it might drain? Interiliac veins, because interiliac vein is very much close over here. Always remember, try to understand, whatever the nerves which are close to that particular organ will be supplied by that particular nerve. Whatever the arteries which are situated close to it will be supplied by that artery. And veins close to that organ will be draining it. Okay, always remember. Even the lymph nodes also. Okay. So the prostatic venous plexus will be draining into internal iliac vein eventually. Internal iliac vein into common iliac vein, and common iliac vein into inferior iliac vein. Okay, in that manner. Okay. So these are about the zones and surgical, lobes of the prostate gland over here. So these two things are important. Surgical lobes of the prostate and anatomical lobes of the prostate and zones of the prostate are important. Okay, you are supposed to know. Okay. So if the prostate is in this form, what might be the surfaces over here? What might be the surfaces? The surface also you are supposed to know. Anterior, posterior, exactly, two inferior surfaces. Okay, so far we have seen the lobes and what are the borders and surfaces. It is actually in this form, pyramidal shaped structure, of course inverted pyramidal or inverted triangular shape over here. So what are the surfaces? One is the anterior surface, and then posterior surface towards the posterior aspect, two infralateral surfaces, just almost close to the urinary bladder surfaces. Getting it up? So what is the anterior surface, posterior surface, and infralateral surfaces. And one more thing, this is the base of the prostate and this is the apex of the prostate. These close proximities you are supposed to know. The base is lying at the level of the neck of the bladder over here. Could you understand? The base of the prostate. Oh, thank you. So the base of the prostate is situated towards the neck of the urinary bladder. The neck of the urinary bladder contains exactly internal urethral orifice. Okay or not, right? The neck of the urinary bladder contains internal urethral orifice. External urethral orifice is situated. External urethral orifice is situated. Tip of the glans penis over here. Okay, these things are important. Internal urethral orifice is situated at the level of neck of the bladder or apex of. No. That is what there is a difference. Trigone of the urinary bladder. At the apex of the trigone of the, for example, this is the trigone of the urinary bladder. This is the apex and this is the base towards the posterior wall, towards the posterior aspect. Okay, towards the apex of the trigone or towards the base of the prostate is the internal urethral orifice over here. And external urethral orifice is situated towards the tip of the glans penis. These are important. Okay. And there are two sphincters over here which controls the continence of the urine. What are the two sphincters? Internal urethral sphincter and external urethral sphincter. Which one is voluntary and which one is involuntary? External is voluntary. So this area is voluntary part of the sphincter and this area is involuntary part of the sphincter over here. Why these sphincters are needed over here? Why these sphincters are needed? To control the flow of the urine outside. Okay, which is called the continence. Okay, continence means you could able to control the urine from leaking out. So if it is involuntary leaking because of the injury to or any other structures over here, it is termed as incontinence, urinary incontinence over here. Okay. So in case of elderly females, because of the weakness of these muscles, stress incontinence occurs. What is stress incontinence? This is important. Stress incontinence. Okay, what is stress incontinence? Incontinence means the patient can't able to control the urine within the urinary bladder. Getting it? So one is the stress incontinence. Because of the weakness of these sphincters over here, in case of elderly females, so whenever the patient coughs or whenever the patient tries to increase the abdominal pressure because of the vomiting or because of the cough or because of whatever it might be, whenever the intra-abdominal pressure increases, involuntarily the urine will be dribbling out. Okay, within small droplets sort of. Okay, droplets of urine will be dribbling out because of the weakness of these sphincters over here in case of elderly females. That leakage of urine because of the increased abdominal pressure, because of the cough or whatever it might be, is called the stress incontinence over here. Get it or not? So for that stress incontinence, they are supposed to increase the tone of these muscles by some exercises. Okay, we'll be learning it later. So one is the internal urethral sphincter over here, one is the external urethral sphincter over here. Internal urethral sphincter will be around this opening over here, just above the prostate and below the neck of the bladder over here, by means of smooth muscle fibers over here, which are derived from the detrusor muscle. You know the detrusor muscle, where it is situated, right? So from few fibers of U-shaped loops of detrusor muscle will be enveloping around this internal urethral orifice and acts like an involuntary sphincter over here. Getting it on? So for this, which nervous system is needed? Autonomic nervous system. How it will act? Just like the stomach and intestines. How it will act? So sympathetic nervous system, what it does to the sphincter? Either this sphincter or this sphincter? What is it? Sphincter, yeah. The sphincter will be contracted with the help of sympathetic nervous system and relaxed by means of parasympathetic nervous system. With respect to the urinary bladder, parasympathetic will be squeezing the urinary bladder so that the urine will let out. So parasympathetic will be relaxing the sphincter over here. Getting it down, everybody, right? And this is a voluntary sphincter, you can control easily. Again, the two nervous systems will be activated over here based on your voluntary control. Okay, if you want to release, you can release the urethra over here. If you want to close it, you can close it. Okay, this is important. Which is involuntary? Towards the internal urethral orifice is the involuntary sphincter. Towards the external urethral orifice, just below the prostate will be the external urethral sphincter, or away from the internal urethral orifice is the external sphincter over here. External urethral sphincter over here. Getting it over? This is voluntary part. This is involuntary and this is voluntary part. Just above the prostate is the involuntary part and below the prostate is the voluntary part of the sphincter over here. Getting it over? So what might be the relations of the prostate over here? In front will be deep dorsal vein of the penis and of course space of Ritzius. Have you studied the space of Ritzius boundaries? Right? Studied or not, right? See, space of Ritzius, study and come, we will be discussing tomorrow, okay? Because the boundaries are short notes. That is for the sure question, okay? The examination, okay? And then behind it will be surrounded by, behind is related to, the prostate behind is related to fascia of Denon-Villiers. How this Denon-Villiers fascia is formed over here? Embryologically, what will happen? Right? Rectovesical fascia pouch will be going downwards till the perineal body over here, embryologically. Okay, but later on this part will be fused and leaving the uppermost part over here. So now this part of the peritoneum will become the rectovesical pouch, but this will be remained as a fascia connecting the perineal body with that of this pouch over here. This is called the fascia of Denon-Villiers. This is important. Fascia of Denon-Villiers. Okay. So whatever this fascia is present over here, what is that fascia? Prostatic fascia over here, which is called the false capsule of the prostate, will be joined with this fascia of Denon-Villiers posteriorly, but will be connected to the pubis by means of puboprostatic ligaments. We have already seen medial and lateral puboprostatic ligaments, which will be connecting neck of the bladder with that of the pubis, body of the pubis over here. So these are the two ligaments with which the false capsule will be joining over here. So these are the puboprostatic ligaments in front to which the false capsule will be joined over here, and behind this false capsule will be joined with the fascia of Denon-Villiers. On either sides of the prostate there will be levator ana muscle, which also acts as levator prostate. The prostate gland will be lifted up whenever they are contracted. So that's why there will be levator ana muscle. What is the origin of levator ana muscle? Right? What is the origin of levator ana muscle? Anterior fibers and posterior fibers, from where they will arise, we have discussed during iliac bone. What right? No, no. What is
Is
it?
it a slide or white line?
Yeah, it's okay. What question I have asked right over here? Levator and origin and insertion. Anybody? Coccygeus.
Ischial spine.
What are we? Forgot everything, yeah? Exactly. So, all the way from the body of the pubis till the pelvic surface of the ischial spine. Is it or not? So that will be the levator ani and coccygeus will be on either sides of the prostate in this manner. Could you able to understand? In between these two will be the prostate, hanging the prostate downwards over here. Okay. Whenever it contracts, it will be lifting up the prostate in this manner. Levator ani and coccygeus over here. Of course, coccygeus is a bit away from the prostate, but levator ani will be lifting up the prostate in this manner. Could you able to understand? This is the anterior aspect, this is the posterior aspect. In between these two is the prostate gland over here. So on either side will be the levator ani in this manner. Getting it or not? So that will be lifting up the prostate whenever it contracts. Okay. So the median lobe of the prostate, if it is enlarged, because of which reason? The median lobe of the prostate enlargement occurs because of which reason? Just now I have told you, no? What is it? Hormonal imbalance over here. Hormonal imbalance over here. Okay. In case of elderly males, there will be imbalance of the hormonal action over here. Okay. Testosterone. What? It will be around the
Around the central zone.
no, transition zone, because it is around the pre-prostatic part, no? I told central zone. Sorry. Okay. The median lobe is situated within the which zone? Transition zone. So from the transition zone is the benign prostatic hypertrophy occurs because the median lobe is situated around the pre-prostatic part. Yeah, logically it's very much right. Okay. So the transition zone will be leading to the median lobe hypertrophy over here. So the central zone, the transition zone will be giving rise to benign prostatic hypertrophy, but the peripheral zone will be giving rise to malignant changes of the prostate over here. So the median lobe, whenever it is enlarged over here, what will happen to the urethral orifice over here? It's not constricted, it is obstructed. Constricted is different from obstructed. Okay, for example, the urethra opening is in this manner, for example. Okay, if the median lobe grows over here, so what will happen? The thickness will be increased over here. So normally in this lumen will be narrowed because of this growth in this manner. So whenever the patient tries to evacuate the urine by increasing the abdominal pressure, what will happen? Obstruction will be increased further. Getting it? It acts like a ball valve over here. Getting it on? Whenever the patient with the benign prostatic hypertrophy because of the hormonal imbalance, so what will happen? The median lobe will grow in thickness, hypertrophy. Okay. So the normal lumen will be occluded partly over here in this manner. Okay. So little bit of urine will be dribbling downwards over here. Getting it on? But whenever the patient tries to evacuate the urine by compressing the urinary bladder, what will happen? The compression will be leading to the further forward movement of the median lobe, so that further closes the urethral opening, so the patient can't able to pass the urine. Getting it or not? So symptoms will be increased over here. Getting it or not? So how the question will be asked? If a patient couldn't able to pass the urine by his own efforts, and that too in case of elderly male, what do you think of? Obviously benign prostatic hypertrophy over here. So if the same patient, elderly, doesn't have any urinary obstruction over here, but have symptoms in the brain, increased intracranial pressure or any disturbances in the cognition means thinking ability, all those things will be abnormal in case of malignant prostatic involvement over here. That is the peripheral zone will be involved over here. Get it out? Two different scenarios over here. Okay. What? Back pain also will be there because vertebral column is involved over here. So obviously there must be back pain over here. Absolutely. Okay. So this is about the prostate gland. What might be the arterial supply of the prostate gland over here? Inferior vessel. What are the vessels which are close to it over here? Nothing but the inferior vesical artery, middle rectal artery, and internal pudendal artery. Pudendal is close to the prostate over here. Vesicle is close to the prostate over here. Rectum is close to the posterior over here. So inferior vesical artery, middle rectal artery, internal pudendal artery is the arterial supply for this. What is it? Prostate over here. Same supply for this urethra also. What is that urethra? Male urethra also will be supplied by the same arteries over here. Just easy to remember. Okay. So urethra is passing through the prostate and everything over here. So that it will also be supplied by the pudendal artery, internal iliac artery, middle rectal artery, and inferior vesical artery will be supplied the urethra also over here. Get it alright? Right? So nerve supply we have discussed now already. Sorry, nerve supply will be supplied by sympathetic and parasympathetic. Why? Because why sympathetic and why parasympathetic nerves are situated, needed for the prostate over here? What is it? Secretion. Secretions will be done by parasympathetic nervous system all the way from S2, S3 and S4. Okay, and sympathetic are needed for pain sensation is sensation. What is motor activity?
Squeezing.
What is that?
Squeezing.
Squeezing of what?
Prostate.
That is done by the parasympathetic nervous system. See, two entities over here, any gland, not only prostate, any other salivary glands, whatever it might be. So the parasympathetic nervous system will be squeezing the glands to secrete the secretions, whatever that is mucus or serous or whatever it might be. Okay. But sympathetic nervous system will be acting on the blood vessels. What is it? The blood vessels will be controlled by the sympathetic nervous system because blood vessels will be constricted so that the blood supply will be happening to that particular gland over here. Okay, sympathetic nervous system focuses on the blood vessels mainly rather than on the glands over here. Getting it alright? Right. So parasympathetic nervous system mainly acts on the glands over here for secretion, and sympathetic nervous system acts on the blood vessels. And of course, the sensory part of the gland, the pain sensation will be carried by means of sympathetic nervous system, and in some areas there will be parasympathetic nervous system also. Okay, in case of cervical region and in the pelvic region, the pain sensation will be carried by the parasympathetic nervous system. Okay, you will discuss later in the lecture classes. Okay, so easy to remember, the parasympathetic nervous system around the cervical region and around the pelvic region will be carrying the pain sensation. Okay, rest of the areas, sympathetic nervous system will be carrying the pain sensations over here. Getting it on it, everybody? Okay, this will be discussed later. So anything we left to in prostate?
Examination.
Examination? So examination, how you will do? It's okay. It's okay. We'll do the examination later on. Many markers are there to identify the prostatic hypertrophy or malignancy of the prostate. It's okay. But how to, whenever a patient comes with obstructed urine, the patient, for example, 60 years old male, okay, the clinical question will be given in this manner. A 60 years old male came to the casualty, he couldn't able to pass the urine and pain in the lower abdomen since yesterday night. For example, he came over here now, since yesterday night he can't able to pass the urine. Okay, right, and he's having the abdominal pain. So how you will approach the diagnosis? The patient is showing the abdominal swelling and abdominal pain and he can't able to pass the urine. So what you will suspect? Abdominal swelling might be because of intestinal obstruction also, or what is that, right? Any other malignant growth also, or any other? We will be discussing that volvulus later. It's okay, about the volvulus we will be discussing that. It's okay. So whatever you know, the abdominal swelling will be occurring by means of because of intestinal obstruction or urinary obstruction or urethral obstruction over here. How you will approach the diagnosis over here? How you will treat the patient, or how you will first of all relieve the symptoms of the patient? Catheter, exactly. Urinary catheter, which is also termed as a Foley's catheter. So you have to induce that Foley's catheter through the penile part of the urethra, and that will be reaching in the urinary bladder over here. So that through this tube, the urine will be drained. Because the patient can't able to drain because of the enlarged what is that? Median lobe of the prostate. So this tube will be separating the median lobe from the urethral orifice over here, and then drains the urine through this tube into the outer aspect over here. In that manner, you can relieve the symptoms over here. So could you able to relieve the symptoms in case of intestinal obstruction? Obviously no. So how to identify the intestinal obstruction? Okay. So whenever two scenarios are present, intestinal obstruction, there is dilatation because of the accumulation of the feces or whatever it might be. And because of the urine accumulation, there is again abdominal distension over here. So how you will differentiate? One scenario, you will be palpating the abdomen on the lower aspect. Patient complains of pain, that is called the tenderness over here. Tenderness means whenever you put on the pressure over the patient, the patient elicits the pain. Right? The patient expresses the pain. That is called the tenderness over here. So one scenario you have identified based on the catheter, you can understand that urinary obstruction is present over here. So if there is no urine in the urinary bladder, but still the patient is complaining with the abdominal distension pain, so how you will identify? So if there is an intestinal obstruction, what will happen? What you mean by flatus? Exactly. What?
No fetus will be passed.
No? Flatus means what? Passing gas through anal orifice over here. Generally, every individual will be passing flatus through the anus. That is a healthy individual. Getting it over? Flatus must be passed outside. Okay. So if the patient is not passing the flatus right from the abdominal distension and pain over here, so this indicates that there is an intestinal obstruction over here. Okay. So that needs a surgical intervention over here. So with this scenario, there will be distension of the bladder over here. So obviously the hypogastric region of the abdomen will be distended over here. Okay. But intestinal obstruction as a whole, the entire abdomen will be distended over here. So based on the history, whether he is passing the flatus or not, you can identify. And through the X-rays also you can identify. Okay, we'll be discussing that later. So there are a few blood markers called prostate specific antigen to identify the malignancy of the prostate over here. Getting it out? If you pass the catheter over here, that indicates the benign prostatic hypertrophy. But if there is a malignant change of the prostate, we have to go for prostate specific antigen, which is a marker to identify the prostatic malignancy over here. Getting it out? Right? So if there is a prostatic malignancy, what will happen? Malignancy of the prostate, what will happen? Again, the obstruction will happen. The obstruction can be relieved by passing the catheter in case of benign prostatic hypertrophy. But in case of prostatic malignancy, even though you pass the catheter, the patient can't able to even, the catheter can't able to even pass through the prostate gland over here, prostatic urethra over here. In that scenario, how we will relieve the symptoms of the patient? For example, there is a prostatic malignancy. The prostate has enlarged over here. So that will be narrowed. So there will be narrowing of the prostatic part of the urethra over here. So the patient can't able to pass the urine passing through the prostate over here. So how you will relieve? How you can directly put it? Yeah, you're right there, absolutely. How? That is treatment. So if you can't able to pass the catheter over here, for example, there is an obstruction over here, the catheter can't be infused into the urinary bladder over here. The catheter even can't reach the urinary bladder to drain the urine. So in that scenario, what will happen? The urinary bladder has distended over here in this manner. Is it not? So whenever the urinary bladder is distended with the excessive urine, where it will reach? It will reach the umbilicus over here. Subperitoneal or intraperitoneal? Subperitoneal, below the peritoneum over here. Get it up? So peritoneum will be going over here in this manner. Okay. So how you will put the catheter? There is a term called suprapubic catheterization. You can put directly the tube into the urinary bladder above the pubis. That is called the suprapubic catheterization. Catheterization means whenever you are putting the catheter, the process is termed as a catheterization. Okay. Normally it is termed as a urinary catheterization, but this catheter, whenever you are putting by putting a small link within the lower abdomen or in the hypogastric region, region, and you are reaching the urinary bladder over here and drains the urine all the way from urinary bladder above this all this setup over here. Okay, this is called suprapubic catheterization. So in this manner, you will be relieving the symptoms of the patient over here. First of all, you have to relieve the symptoms of the patient, then only you can remove the prostate over here. Otherwise, the bladder will burst over here. Getting it or not? And the patient will die of internal bleeding and everything. Okay. So if the patient is elderly female, will you think of prostate? Why? Female doesn't have prostate gland, obviously, right? So let us see the urine. And one more thing I want to tell you. See, every organ's length, breadth and thickness and weight will be asked in the examination sometimes. Okay, you are supposed to learn. Okay? Getting it alright? What right? Wait. Yeah, I missed you to focus on the important points, right? But those. Okay. So you can remember roughly, like for example, what is the volume of the stomach? Normal volume of the stomach? 1.5 liters. What will be the weight of the liver?
1.6 kg. Range.
What's the length of the exactly? What's the length of the kidney? Right sided?
12, 5 and 7. These are the numbers and the dimensions. Sir, 2 to 3, 5 to 7, 10 to 12.
What's it? What I'm asking is length of the kidney. Length of the kidney on either sides. Length of the kidney on either sides.
12 centimeters. 12 centimeters.
Right kidney 10.5, left kidney 11 centimeters. No, 11.5 centimeters. Okay. Why? Left kidney will be a bit longer than the right kidney. So these lengths, you just remember roughly. That means almost average lengths and average breadths. If you remember, that's okay, fine. Okay. Getting it on it? These will be asked in the examination. And in case of brain, whenever you reach the brain, they will ask the surface area of the brain also. Okay, that will be given them. Okay. And then let us see the urethra over here. The urethra of male. The urethra of male, let us see the first one. Okay, so male urethra, it will be extending from. Come on, let us finish it off fast. Come on, everybody. So the urethra, in case of males and in case of females, which one is lengthier? Obviously, the male urethra will be around how many centimeters, right? How many centimeters, right? In case of males, around 18 to 20 centimeters. And in case of females, it is 4 centimeters. Why this length is needed for us? For everything, there is a specific reason. For example, 18 to 20 centimeters in case of males and 4 centimeters of urethra in case of females. So females are more prone for urinary tract infections compared to the males over here. Getting it alright? In case of males, there will be acidic prostatic secretions also that will prevent the bacteria from reaching the urinary bladder over here. But in case of females, the setup is not there over here. Okay. So females, because of the shorter urethra, the females can easily prone for urinary tract infections. Getting it alright? So in case of females, the urethra will be this much and the urinary bladder will be over here. And this is the external urethral orifice. Getting it alright? But in case of males, all the way about from here to here till this part over here. Around 18 to 20 centimeters is the length of the urethra of the males. So less chances of urinary tract infection in case of males over. Okay. And one more thing, many people are asking why females peritoneal cavity is open type and why males peritoneal cavity is closed type of peritoneal cavity. What's the reason? Peritoneal covering the ovaries? Is the ovarian. So why it is called open type and why it is called closed type? Uterine tube?
Connects the peritoneum. If the uterine tube, then the uterine cavity should not have any.
Yeah.
It's open outside.
Yeah, absolutely. So the external environment, whenever it is open to the peritoneal cavity, getting it on? What is that? This will be asked in the examination. External environment. Okay. With that of the peritoneal cavity. So how the external environment can reach the peritoneal cavity? The external environment will be having bacteria, viruses, and all those things, right? So how these bacteria and viruses can reach the peritoneal cavity? So if you get the generalized peritonitis, it's an emergency situation. The patient may die. Getting it up? So external environment is reaching the peritoneal cavity over here. In case of males, it can't reach. That means the virus and bacteria can't able to reach the peritoneal cavity. But in case of females, the pathogens can easily reach the peritoneal cavity. What is the reason?
Because this is a pelvic.
Exactly. Okay, first of all, let us see that. See, here in case of females, where is the peritoneum over here? Peritoneum class is already over. So somebody should tell me. Peritoneum class over or not, or lecture class? Over now? So then tell me where the ovaries are situated and where the fallopian tubes are situated with respect to the peritoneum. Ovaries are intraperitoneal, means within the peritoneal cavity. So this entire is, for example, peritoneal cavity over here. Ovaries are within the peritoneal cavity. Okay. And what about the fallopian tubes? What about the fallopian tubes?
Sorry,
Extraperitoneal. Okay. How it can be extraperitoneal? For example, if you take the peritoneum all the way from the posterior abdominal wall, this is the anterior abdominal peritoneum, this is the posterior abdominal peritoneum. It will be going over the uterus, is it not? Here over the rectum over here. Above the fallopian tubes, it will go and forms the broad ligament over here. And then goes further over the urinary bladder and continues as the anterior abdominal walls peritoneum. Getting it up? For example, the fallopian tubes are situated over here in this manner. Okay. Now we are focusing on the sagittal section. Okay, sagittal section. Okay. This is the posterior abdominal walls peritoneum. This is the anterior abdominal walls peritoneum over here. So it will be reflected over the urinary bladder and then followed by the uterus over here. So whenever it is going over the uterus, it will be going over the fallopian tubes also over here. Okay. So fallopian tubes are situated in this manner, for example. Over the fallopian tubes, it will go. And then further goes and encloses the rectum and goes and becomes the posterior abdominal walls peritoneum over here. Getting it? But the ovaries are situated within the peritoneal cavity over here in this manner. Getting it or so ovaries are intraperitoneal and rest of the uterus and fallopian tubes are extraperitoneal, outside the peritoneal cavity. But how the external environment is reaching the peritoneal cavity over here? The ovaries and the fimbria are connected by means of a fold of peritoneum over here is called as meso-ovarium. So whenever it is reaching over whenever it is going over the fallopian tubes, it will be giving rise to a fold of peritoneum which joins the fallopian tube, that nothing but the fimbria of the fallopian tube, with that of the ovary. So this part is this part over here. Get it or? So whenever a pathogen enters through the vagina over here, first of all, so this part is the vagina, cervix, uterus, fallopian tubes, and ovary over here. So the pathogen can easily enter through the vagina and then into uterus and then into the fallopian tube and reaches the fimbria and then enters into this fold of peritoneum called meso-ovarium. From this onwards, it can easily enter into the peritoneal cavity. Get it on? So, in case of female citizen, the pathogens are, or to the external environment, the peritoneal cavity is open short of. Getting it on? Open type of peritoneal cavity because of this communication in this manner. So the peritoneal cavity is clearly in contact with the external environment over here. But in case of males, what will happen in case of males? In case of males, the pathogens can enter through the urethra. No other opening is present. Is it not? No other vagina for the males. Okay. So obviously, the pathogen can enter through this urethra and can reach the urinary bladder, and then further it will be reaching the kidneys over here. Is it not? Kidneys over here. So all the way from the urethra, it will pass through the urethra and everything and enters into the urinary bladder. Urinary bladder is connected to the kidneys by means of ureters over here. So the pathogens can reach till the kidneys. Kidneys are not open to the peritoneal cavity. Kidneys are retroperitoneal structures and there is no opening or contact in between the peritoneum and the kidneys apart from retroperitoneal aspect. Okay. So till the kidneys, the infection can reach. From the kidneys, the infection can reach through other areas, through renal vein and everything, but not into the peritoneal cavity over here. So for that reason, in case of males, the peritoneal cavity is not open to the external environment over here. The pathogens can maximum reach to the kidneys over here, not into the peritoneal cavity. Getting it or not? So this is the reason why in case of males it is closed type, and in case of females it is open type of peritoneal cavity. Everybody understood or not? Understood or not? No? Understood or not, everybody? Yes. Understood or not? Because this will be asked in the exam, that's why I'm stressing much. So let us discuss the urethra. It's very much easy, right? Come on. Come on, everybody have studied already. What's the urethra? Come on, everybody. Let us finish it off faster. The urethra in case of males and in case of urethra, the females of urethra. Female urethra. Okay. First of all, the male urethra all the way begins from the internal urethral orifice at the neck of the bladder and will be till the external urethral orifice at the tip of the glans penis over here. Okay. So what are the parts of the male urethra? What is the pre-prostatic, prostatic, membranous part of the urethra and spongy part of the urethra. Along that, bulbar part of the urethra also will be present. So what are the parts of the male urethra over here? First of all, there is a pre-prostatic part of the urethra. So that means it will be extending from the neck of the bladder till the folliculus seminalis. Okay. Seminalis, folliculus seminalis. See everybody, let us finish it off faster. This is the urinary bladder over here. Okay, these two brown lines are the urinary bladder over here. So now we are in the coronal section of the urethra. Okay, pre-prostatic, prostatic part of the urethra we are focusing on now. Okay, so this is entirely the prostate over here. Above that, this part is the neck of the bladder or apex of the trigone of the bladder. Okay, right. So this is the pre-prostatic part, which is surrounded by means of muscle fibers in the form of U-shaped loops over here. So that is the internal urethral sphincter, which is derived from the detrusor muscle. Okay. So this is an involuntary muscle. Okay. So this part will be continuous into the prostate over here as a pre-prostatic part of the urethra. So till what part is the pre-prostatic part of the urethra is the colliculus seminalis over here. Okay. The colliculus seminalis is a swelling over the inner aspect of the urethra. Okay. First of all, see over here. So now if you are doing a coronal section of the urethra, prostatic part of the urethra, you can see a median eminence sort of mucosal protrusion occurs in the urethra over here. That is called what? You know what is crest means? Is it not? Crest means an elevated portion. Absolutely. So this is now on the posterior wall of the prostatic part of the urethra over here. Okay. So this contains an elevated portion which is narrow above and broader below over here. In the central part, it will be a circular swelling will be present over here. Getting it or? So this is the elevated mucosal portion which is called the urethral crest over here. Mucosa, only mucosa. Okay. In the middle portion of this, there will be circular swelling. One more swelling occurs. That is called the which is also termed as the verumontanum over here. Verumontanum. Okay. Okay. Try to understand this properly, everybody. So there is a swelling all the way from above downwards within the prostate alone. That is called the urethral crest over here, which is a mucosal elevation, longitudinal mucosal elevation. In the middle of this longitudinal mucosal elevation, there is a circular elevation, one more circular elevation. Okay, that is called the verumontanum or colliculus seminalis, which contains 3 openings over here. The central opening is for so if you see properly, everybody, there is a what is this? Diverticulum. What's that? There is a diverticulum behind the median lobe of the prostate. Okay, try to understand this properly. This is the prostate gland over here. This part is the median lobe. Okay, just behind the median lobe, there is a diverticulum projects outwards from the posterior wall of the prostatic urethra. Okay, so this is termed as prostatic utricle. Prostatic utricle. This part is important. That's why I'm stressing again and again. So this part is important for histology and for the gross as well, as a theoretical question. To try to understand this problem. Okay. So prostatic utricle is a diverticulum which will be arising all the way from the posterior wall of the prostatic urethra and goes behind the median lobe, just behind the median lobe. Okay. So that opening will be over here. That is nothing but the opening for the prostatic utricle over here. And on either side, these 2 openings are for the ejaculatory ducts over here. So again, these also lies just behind the median lobe over here. So behind the median lobe, in the center there is prostatic utricle, and on either side there are ejaculatory ducts over here. Getting it or not? So this is the median lobe over here. In the center there will be prostatic utricle. On either side there will be ejaculatory ducts over here. Getting it or not? On either side there will be ejaculatory ducts. In the center there will be prostatic utricle over here. Okay. So this is for the prostatic utricle and this is for the ejaculatory duct. These 2 are for the ejaculatory ducts. Okay. So on either sides of the verumontanum or colliculus seminalis, there is a depressed area of the urethra over here. That is called exactly prostatic sinus. Okay. Sinus means it's like a cavity or a depressed area over here. Okay. So this is the swelling in the center. In the center there will be one more rounded swelling, but on either sides of these 2 swellings there will be depressed area on either sides over here. Okay. So this is nothing but the prostatic sinus. Plural will be prostatic sinuses on either sides will be. So what is the need of these sinuses over here? What will happen over here? So the urethral glands will be opened into these sinuses over here. So into this swelling there will be 3 openings. One is a prostatic utricle and on either side is the ejaculatory duct. So what will be secreted by these 3 structures over here? Prostatic utricle will secrete mucus. Okay. Ejaculatory ducts will be secreting seminal fluid along with the spermatozoa. Absolutely. Spermatozoa and seminal fluid. Is it not right? Right? Because seminal fluid will be secreted by the seminal vesicle and vas deferens will be delivering the spermatozoa. Both will be joined together and forms the ejaculatory ducts over here. Okay. Right. So on either side there are glands, urethral glands, which will be opened into the sinuses over here, prostatic sinuses over here, which will be again secreting the mucus secretion over here. Getting it over? So mucus secretion over here, mucus secretion on either sides. Okay. So this is about the prostatic part of the urethra. Okay. But till this part is a pre-prostatic part. Till what part? Till the beginning of the verumontanum or colliculus seminalis is the pre-prostatic part. Even though it is in the prostate, it is termed as pre-prostatic part theoretically. Getting it on? It is not like before the prostate over here. It is within the prostate, but till the folliculus seminalis over here, or verumontanum over here. From then onwards, till it reaches the diaphragm. What is that? Urogenital diaphragm over here. It is termed as prostatic urethra over here. Getting it on? So from this part till this part is the prostatic urethra over here. Getting it on? Pre-prostatic above, prostatic below, till the superior layer of the urogenital diaphragm over here. Getting it on? Urogenital diaphragm are formed by which muscles? Already lecture would have happened. Urogenital diaphragm is formed by which muscle? Deep transverse. So another name for deep transverse perineum, profundus. And then one more. Sphincter urethrae. Sphincter urethra. What is the origin of sphincter urethrae? Origin of sphincter urethrae. Origin of sphincter urethra from where? Right? Array. See. Yeah, what's that? What's that? Exactly, ischiopubic ramus. The pelvic surface of the ischiopubic ramus. Could you able to remember? It is divided into three surfaces by means of two horizontal ridges. The two horizontal ridges will be giving rise to superior layer and inferior layer of the urogenital diaphragm. So it will be in the intermediate part of the ischiopubic ramus. Getting it or not? So people don't need to mug up. If you imagine, then you can get the answer. Okay? Never mug up anatomy. Okay? If you able to understand, you may forget if you mug up, but if you try to understand, you can get it easy. Okay? Okay? Let us see that. Okay? Let us see, come on, let us finish it up faster. So much is there. So this is the urogenital diaphragm, which is formed by sphincter urethrae and transverse perineum profundus over here. Okay. This upper layer of fascia is termed as the superior layer of the urogenital diaphragm, and this lower layer is termed as inferior layer of the urogenital diaphragm, which is also termed as perineal membrane over here. Okay. So whatever the urethra within this two layers of the fascia over here is termed as the intramembranous part of the urethra. Get it or not? Intramembranous part of perineal membrane, intramembranous part of the urethra over here. So far we have seen pre-prostatic part and prostatic part, and now within these membranes over here, intramembranous part of the urethra, but surrounded by these muscles, which are nothing but sphincter urethrae and transverse perineum profundus. So these will act as external sphincter, which is voluntary. Getting it or not? So you are controlling your urethra at which level of the hip bone? What, right? At which level of the hip bone you are controlling your urethra? What, right? Ischiopubic ramus. Not at the level of pubic symphysis over here, but at the level of ischiopubic ramus you are controlling your urethra. Get it or not? Urinary outflow is controlled at the level of ischiopubic ramus, not at the level of pubic symphysis, because just behind the pubic symphysis is the internal urethral sphincter over here, where you can't able to control. But at the level of the ischiopubic ramus, you could able to control your urine outflow over here. Getting it or not? Acting as external urethral sphincter over here. Okay. So then followed by, it will be entering into a bulb of the penis. It's a part of, bulb of the penis is a part of, what is it? Yeah, root of the penis is okay, but actually it forms what? Corpus spongiosum, exactly. So the corpus spongiosum, see properly over here everybody. So look at this purplish area over here. This purplish area is the see here, could you able to see the diagram over here? Try to understand this properly, okay? So this is the intramembranous part or membranous part of the urethra over here. The membranous part of the urethra enters into the bulb of the penis, which eventually forms the corpus spongiosum. Okay, and further forms the glans penis over here. Glans penis is a part of corpora cavernosa or corpus spongiosum. Corpus spongiosum. Corpora cavernosa will not form any glans penis over here. Okay. Okay, fine. What is phimosis? What is phimosis? The last class we have discussed. Neck from the penis will be. How it is fibrosis?
By the secretion,
When secretion of smegma. Smegma is a sebaceous gland secretion. It's not a sweat gland secretion. It's a. Do you think that sweat glands are needed in the penis? That means within the glans penis. Sweat glands, right? Within the glans penis, you need a sweat glands or not? See, the skin prepuce is mobile over the glans penis. So that needs a lubrication. So oily secretions will give rise to lubrication. If the sweat glands are present, that leads to infection. The salty nature and everything that ruptures the mucosa over there, that leads to infection. So sweat glands are not needed. On the skin it is needed. Why it is needed on the skin? Skin of the penis and skin of the scrotum contains sebaceous glands and sweat glands. Cooling effect, absolutely. How cooling effect occurs? What for cooling effect is needed? Absolutely. For the testis, temperature must be lesser compared to the actual body temperature. So through the sweat glands, the heat will be disposed of. So the temperature will be lessened in the testis. That is nothing but in the scrotum over here. So for that sake, sweat glands are needed in the scrotum. Getting it over? But sebaceous glands is needed for lubrication. Getting it over? So smegma will be released in the neck and the corona gland is. What is corona gland is? The base of the glans penis is also termed as corona glandis. Everyone's favorite is corona, isn't it? Corona, right? Coronavirus. Coronavirus? Have you encountered coronavirus infection or not? No? Yes, sir. Very good. Anybody know it? No. So everybody took vaccines or not? Yes. I didn't take. It's okay.
Because you are group now, you.
Okay. So phimosis. Come on, let us see that. Let us finish it off. Right? Come on. Phimosis. You want to know? Over. Okay. So the membranous urethra over here turns into bulbar part of the urethra within the bulb of the penis, which is the posterior end of the corpus spongiosum over here. Okay. So within this bulb, this urethra will be dilated over here and forming a fossa over here. That is called intrabulbar fossa over here. So whenever it is expanded over here, the urethra part within the bulb is expanded over here or distended over here. Naturally it is distended. That is termed as intrabulbar fossa over here. Getting it or not? And then further followed by, whenever it is entering into the corpus spongiosum, it is termed as spongy part of the urethra over here. Getting it or not? In the spongy part of the urethra is dilated within the glans penis over here and forming one more fossa called navicular fossa. So energy is got over, right? Energy over. It's okay. Only little bit. We'll finish off the male urethra, female urethra will be discussed in the next class. Okay. So there is one more fossa called the dilated portion of the urethra within the glans penis. Three dilatations. One in the prostate because of the presence of the verumontanum and everything, and another dilatation is the intra-bulbar part of the urethra, nothing but the intra-bulbar fossa. One more dilatation of the urethra with the glans penis, that is called the navicular fossa over here. Why these dilatations and narrowing things are needed? Because of male urethra. Yes, it's almost alright. For example, if you take a hose pipe, for example. If you take a hose pipe, so if you leave it, the urine will be dribbling. Normally it will be dribbling out. Is it or not? Right? So whenever you squeeze the end, nothing but the opening of the hose pipe on the other end of the tap, so that force will increase. Is it or not? Isn't it not right? Right? So because of this irregularity, it acts like squeezing the other end of the hose pipe. so that the urine will not be released outside as droplets, but it is delivered outside as projectile action over here. Getting it or not? What is projectile? Sudden pull, sudden gush sort of. Could you able to understand? So the urine will not be delivered as droplets outside because of this irregularity. Because of this irregularity, it will squeeze the urethra easily, so that it will be gushed out very forcefully. Getting it or not, everybody? So that is the reason for this irregularity over here. But in case of females, there is a smaller urethra, there is no chance of irregularity over here. Getting it or not? Could you have 5 more minutes, right? Could you? No, huh?
Yes, sir.
Okay, right.
Part 3. আর পাচ্ছি না।
See everybody, throughout the urethra, 5 minutes will finish now. Okay. So for example, we are now in the spongy part of the urethra, spongy urethra. So this contains few sinuses over here. Sinuses means this mucosa will be projected into the substance of the urethra as spaces over here. These are called the urethral sinuses. So what is the need of this sinus? The urethral glands which secrete mucus will be releasing their contents into these sinuses over here. Getting it or not? So there are urethral sinuses throughout the spongy urethra over here. Those are the depressed areas of the urethra over here. Okay, this is the lumen of the urethra, and here is the substance of the urethra. Into the substance of the urethra there will be depressions or pits sort of. Those are called the urethral sinuses. Why these sinuses are needed? These are connected to the urethral glands over here, which secretes mucus again. So those mucus secretions will be collected within the sinus and ultimately will be released into the lumen of the urethra over here. Okay. Among these, urethral lacunae, not sinuses, urethral lacunae. So these are the urethral lacunae. Lacunae means deficiency. You know that? Lacunae means deficiency or not, right? So one of the lacuna is bigger one, which is lying close to the dorsal aspect of the navicular fossa. What is navicular fossa? It's a dilated portion of the urethra within the glans penis over here. So towards the dorsal aspect there will be one lacuna over here. That is called the lacuna magna. Lacuna magna. Okay, these are just theoretical things you are supposed to remember. Okay. Just we'll have a look at the viscera over here, right? Nothing much. I've been seeing so many new cases today. Why so? What is right from beginning? So somebody wants to revise the distance, you can revise. Nothing much, just surfaces, that's all. Because you can't see anything. Let us see, whoever is going to see this.